As you can see, it's been a very busy year since we last got together, and as I said, that's the way it should be. Every year should be busy, because our work's really never going to be done. The activities of the Academy mirror and support those of the profession, which, as Steve alluded to, and as Dr. Benjamin, our Surgeon General, has so eloquently stated, is more than a profession. You really represent a movement. And now I'd like to introduce the man who will build on the strong foundation that we've built over the past couple of years, and that is our President-elect. Please join me in welcoming Patrick Killeen.
Hey, Patrick. Good luck.
Friends, distinguished guests, family, and fellow PAs, let me add my welcome to Atlanta and AAPA's 38th Annual Conference. I'd like to thank the woman who's known me the longest, my mother, Catherine Killeen. Please welcome her to our Academy, and my family. It's an incredible time to be a PA. We're at the forefront of historic changes in healthcare, and we are all challenged with these new realities. And during my year as president, I will focus on our next steps: advocacy and the implementation of healthcare reform. So let's talk about that for a moment. As Steve and Bill have mentioned, the Academy, on behalf of its members, accomplished much last year and truly advocated for our profession. I'd like to thank the Academy leadership and really thank all of you who've worked with us as physician assistants to ensure that physician assistants were incorporated into the new federal healthcare legislation. We are an important part of providing high quality, cost-effective care, extending access to care to all patients, and it's good to see that affirmed in the passage of the Patient Protection and Affordable Health Care Act. As a profession and as an organization, we continue to build on a strong foundation for our future, and we've worked hard for our recent successes. But our work isn't over. When President Obama signed the health care reform bill into law, our work moved to the next level, where implementation of that law, the development of rules and regulation, will now be our focus. The Department of Health and Human Services and other governmental agencies will be developing regulations for every provision included in this bill. And the Academy will ensure diligently to make sure that PAs are included in the broader provisions that are being created. Some of the new provisions will be rolled out this year and next, but most of the program will not be in place until 2014. That means the implementation phase of this act will also require dedicated advocacy work. Using our healthcare reform principles as a guidepost, the Academy will not only develop and review and develop the regulations that directly affect the ability of PAs to provide medical care, but also the regulatory framework that will be necessary to administer the new health care programs. The Academy will also strive to keep the AAPA membership informed of the implementation of this new law, as well as to call upon Academy members to be advocates throughout this process. Additionally, although we've made some incredible strides, including PAs in healthcare reform, we still did not secure some critical provisions in the new law. For example, PAs still cannot order home health care for Medicare beneficiaries, or order or provide hospice care for those beneficiaries. But we will not let these provisions go unchallenged. We will continue to work to change this law. Not only do we need to be strong advocates for our profession at the federal level, but also the state level, where state legislatures and governments will be asked to implement new programs for which they have limited experience, all at a time when most are experiencing budget shortfalls. Since much of reform implementation depends on states, we also need to encourage our state legislators, governors, to develop the best regulatory mechanisms to make affordable health coverage available through the new healthcare insurance exchanges. In addition to reform implementation, AAPA has identified 6 key elements that should be included in every state PA Practice Act. 1. Licensure as a regulatory term. 2. Scope of practice should be determined at the practice level. 3. Adaptable supervision requirements. 4. Chart co-signature requirements should be determined at the practice site. 5. Full prescriptive authority. And finally, the number of PAs a physician may supervise should be determined at the practice level. These key elements are vital facets of a PA-friendly working environment. Currently, only 2 states have implemented all of these elements at this point. Therefore, all states should have a way to work at becoming more knowledgeable about this aspect so that they can have real utilization of PAs and when that is realized fully. We understand the challenges that PAs face in their everyday practice when they must advocate against a law or must work for better laws just so they can do their jobs. And we know that advocacy is done better face-to-face. Because of that, the Board of Directors committed to pursue legislative advocacy opportunities. AAPA is committed to identifying, encouraging, funding legislation advocacy opportunities at PA-related meetings in the Washington, D.C. area and other local meetings. Changes in state laws are just as important as those as the federal law. As federal healthcare reform legislation is put into place, it's important to know how your state is responding to the healthcare environment and what rules will be enacted that affect your practice, either positively or negatively. The Academy has worked closely with its state chapters, and at this critical period, we will work even harder for our chapters and with our chapters. There are many things that happen on a state or specialty level that affect the practice of healthcare overall. For example, on the surface, emergency room overcrowding may seem like an issue particular to PAs in emergency medicine. But there are many factors outside of emergency medicine that lead to this overcrowding. For example, lack of preventative care, limited community health resources, patient misunderstanding about care that needs emergency attention, and the lack of primary care practitioner availability. When all patients work to extend primary care for all people, to educate patients about preventative care, and to support rural health care initiatives, we will have collectively made great strides for health care. The years ahead promise to be just as exciting and active as last year, and this will require hard work, all on your part and our part. But PAs are used to hard work. We've been working hard for more than 40 years to increase access to care and to provide high-quality, patient-centered care. Our commitment to that goal remains, and I pledge to continue all this work that allows all PAs to practice at their fullest potential on behalf of our patients. Please enjoy your week here in Atlanta, and thank you for your continued hard work and your dedication to our profession, because together, I know that we can make that impact.